channel. So if you are preparing for drug inspector exam, this video is must for watch for you. So today I will cover the complete list of important poisons and their antidote, which are frequently asked in exam. So this series is will be like must know for drug inspector exam, where no theory, no extra lectures, only must know points with easy memory tricks. So let's begin. And if you are new to this channel, please subscribe to my channel and don't forget to like this video. So let's start. Firstly, commonly asked and very high that frequently asked most of the poisons and their antidote. So let's start. First is acetaminophen and paracetamol. For this, we use N-acetylcysteine and methionine as an antidote. For aspirin or salicylate, we use sodium bicarbonate, which helps to alkalization of urine. So next is anticoagulant for that is warfarin. For this poisoning, we use vitamin K as an antidote. Then next, for opioids poisoning, we use naloxone and naltrexone. Opioids are mainly cause respiratory depression. For this, we use naloxone and naltrexone. So we can say that OP-NANA. So next, organophosphate. For organophosphate poisoning, we use atropine or without with or without pralidoxim. Uh, so this next is benzodiazepine. For benzodiazepine poisoning, we use bromazepine as an antidote. Then next, iron. For iron poisoning, this cause mainly severe GI and metabolic toxicities. For this, we use difeprozamine and difeprone as an antidote. The next, isoniazid. Isoniazid it's mainly cause seizures while in a poisoning. So for this, we use pyridoxine as an antidote, that is vitamin B6. Then next, uh, poisons are related to cardiotoxicity. So first is beta blockers. For beta blockers, we use glycagon as an antidote. For calcium channel blockers, we use calcium gluconate as an antidote. For heparin, we use protamine sulfate as an antidote. Okay. So next is fibrinolytics, that is streptokinase. For this, we use EACA, that is epsilon amino carboric acid. For theophylline or caffeine poisoning, we use isamolol as an antidote. For valproic acid, we use carnitine as an antidote. These are the cardio-related cardio drugs that causes toxicity and their antidote. The next is gas and metabolic poisoning. For carbon monoxide poisoning, we use 100% oxygen as a treatment, that is hyperbaric O2. Then next, for cyanide poisoning, we use hydroxycobalamin, amyl nitrate, or sodium thiosulfate. Amyl nitrate is also used for the hydrogen sulfate poisoning. Okay, so next, methanol poisoning, we use ethanol or fomepizole. For ethynyl glycol, we use ethanol or fomepizole. Fomepizole is US FDA approved antidote for this. So next, methemoglobinemia. For this, we use methylene blue, methimo or methylene. We remember like that. For this, ethanol. It's we use remember like that, and with this methylene blue, we use high flow oxygen for treatment. Then next, so we also see that heavy metals are most commonly asked in the question. So these are important to remember. So as for arsenic poison, we use EDTA. For mercury poisoning, we use enethol, that is DMPS. For lead, we use DMSA, dimercaptosuccinic acid. Then heavy metal, for generally we use dimercaprol, that is BAL. For copper poisoning, that is Wilson disease, for that we use D-penicillamine. And for uranium and plutonium, these are radioactive metals. For this, we use DTPF. And if a question will be like ask will be like what is the antidote for radioactive metal poisoning, it will be like DTPA. So next is CNS atomic toxicity. For atropine, that is anticollagen toxicity. For this, we use physostigmine, and for carbamates, we use atropine. So next is for ergot alkaloid, we use nitropuracide. And for next, that is exam related relevant, most of the question are these. So for we know that activated charcoal is a universal antidote. If you we don't know the nature of a poison, we use activated charcoal. So this is used as an absorption of toxic drug. So for next is lithium toxicity, we use hemodialysis. For hydrogen sulfide, we use amyl nitrite. For levodopa and isonide toxicity, we use pyridoxine. And then for salicylate, severe toxicity, we use alkaline diuresis. Then methyl overdose, that is long-term opioid dependence in chronic cases, we use naltrexone. Here are the 35 poisons and their antidotes. I hope you like this video, and this is a complete list of must-know antidotes for drug inspector exam. If this help you, like, share, and subscribe. See you in the next video. Thank you for watching. Bye bye.